I'd like to thank the conference organizers for inviting me here today. And over the next few minutes, I'd really like to shift the discussion a little bit from the lab to the clinic and explore the potential role of weight loss in cancer prevention and cancer control. I think we're all pretty familiar with the fact that excess adiposity, obesity, is linked to an increased risk of chronic disease, heart disease, diabetes, but there's much less awareness of the links between obesity and cancer risk. As recently as 2014, a Pew survey of US adults found that fewer than 7% of individuals identified obesity as a risk factor for the development of cancer. And yet the evidence has been mounting, especially over the last 20 years. This seminal paper, published in the New England Journal in 2003, looked at the relationship between body mass index and the risk of developing and dying from malignancy in a cohort of about 1 million US adults, followed for 16 years. The investigators found that the heaviest members of this cohort, having a body mass index greater than 40 kilograms per meter squared, had about a 2-fold increase in their risk of fatal cancer. They were also able to identify a number of malignancies for which obesity was a risk factor. And this really ranged from non-Hodgkin's lymphoma, where there was a 2-fold increase in the risk of developing and dying from the cancer in the heaviest versus lightest individuals, up to a 6-fold increase in the risk of developing and dying from endometrial cancer. Since the time that this paper was published, there have been 1,000 reports looking at the relationship between body mass index, body composition, waist-hip circumference, in the risk of developing malignancy. 2 groups, the International Agency for Research in Cancer and the World Cancer Research Fund, have independently analyzed these data and have found the same list of roughly a dozen malignancies where there is clear and consistent evidence that excess body weight increases the risk of developing that cancer. And again, there's a range. There's about a 10% increase in the risk of developing thyroid cancer with excess adiposity, up to a more than 7-fold increase in the risk of endometrial cancer. So this awareness of the relationship between obesity and cancer is coming at a time when we're all aware that obesity has become much more prevalent, not only in the United States, but really around the world. And so there have been efforts to estimate, well, what is the increasing risk of obesity, the increasing prevalence of this condition, doing to the risk of developing malignancy? One assessment of this looked at body weight in the United States and in the United Kingdom in 1990 and again in 2007, and found that the average adult in those 2 countries had increased in body weight by between 9 and 18 kilograms in that less than 20-year period. The range reflects gender, race, ethnicity, and geographic distribution. These investigators then went on, using SEER data in 2007, and estimated, sorry, this cough that seems to be now spreading very quickly, found that 4% of cancers in US men and 7% of all cancers in US women were directly attributable to obesity. So that's about 90,000 cases of cancer just in the US each year attributable to obesity. They then went on to estimate if obesity continued to increase at current rates over the next 20 years, in addition to that 90,000 cases a year of cancer attributable to obesity, there would be an excess 500,000 cases of malignancy that develop due to obesity just in the United States. And based on these statistics, we estimate that by 2030, obesity will be the #1 preventable cause of cancer in the United States. So, these are obviously very, very sobering numbers, but the thing that this doesn't take into consideration is that this is really, all of these estimates are based on our understanding of the trajectory of weight change over time that has been consistently seen to this point. So people are leaner early in life, and then they gain weight as they age. What this doesn't take into consideration is that more and more individuals now are obese throughout their life courses, and it also can't account for the very high levels of obesity that are increasingly being seen in the United States. So we don't really know how those factors are going to influence cancer rates over the coming decades, but there are some warning signs that are starting to be seen. At Dana-Farber in the last few years, my colleague Kimmy Ng has started a new center for early onset colorectal cancer. And this center was founded based on the observation that although colorectal cancer in general is declining in the US population, there has been about a 40% increase in the risk of colorectal cancer in younger patients between the ages of 20 and 49. This is still an uncommon disease, but that level of increase over a short period of time has been concerning. And although the etiology of these young onset colorectal cancers is likely multifactorial, one of the factors that has consistently risen to the top is the relationship between obesity and young onset colorectal cancer. Individuals who have a body mass index greater than 30 have an almost twofold increase in the risk of early onset colorectal cancer. And when you look at individuals who gain significant amounts of weight through their early adulthood, the risk is also significantly increased. And so I think we don't fully understand the full implications of current body weight and the way that that will affect cancer risk in the years to come. So I think it's quite clear that obesity is related to the risk of developing malignancy. But as a physician, one of the things that I really want to know is this something that we can modify through interventions? What is the evidence that losing weight may actually have an impact on an individual's risk of developing or dying from malignancy? Unfortunately, there are no large-scale randomized trials looking at weight loss interventions for cancer prevention. But there has been some very provocative evidence in the last few years that has arisen from the bariatric surgery literature. Again, these are not randomized trials. In these studies, individuals who undergo bariatric surgery are matched by BMI, age, and gender, and they're followed prospectively for the development of malignancy. These studies have consistently demonstrated that individuals who undergo bariatric surgery have a significantly lower risk of subsequently developing cancer compared to matched individuals who don't. On the left-hand side of the slide here, you see a meta-analysis published in 2014 of the larger cohorts, demonstrating a 50% lower risk of developing malignancy in individuals who underwent bariatric surgery versus those who did not. As these cohorts have been followed over time, a clear pattern has emerged that the malignancies for which the incidence have declined are the cancers that are related to obesity. This was an analysis from the Kaiser Group published 2 years ago, 22,000 individuals who underwent bariatric surgery, 66,000 matched controls. It demonstrated, as has been seen in other studies, about a 50% reduction in the risk of overall cancer in the bariatric surgery patients, but starting to show significantly lower rates of obesity-related cancers such as colorectal cancer, endometrial cancer, pancreatic cancer, and postmenopausal breast cancer. So really suggesting for the first time that this is a modifiable factor and we may be able to impact subsequent risk of malignancy through an intervention such as bariatric surgery. Now, only a small proportion of individuals undergo bariatric surgery, and there has been less information about lifestyle-based weight loss until very recently. Many of you in this room are likely familiar with the Look Ahead study. This was a randomized trial that enrolled individuals with type 2 diabetes and randomized them to usual diabetic care versus usual diabetic care plus a weight loss intervention. The overall goal of this trial was to determine whether this weight loss intervention would reduce the risk of cardiovascular events in this study population. The intervention involved nutritional support, reduced calorie diet, increased physical activity. And it was very successful in reducing body weight in the intervention participants. Again, these were not the levels of weight loss that you see in a bariatric surgery cohort, but there was a 10% weight loss at 1 year that was maintained over time. Unfortunately, the trial did not meet its primary endpoint, and there was not a significant reduction in the risk of cardiovascular events in patients who were randomized to the weight loss intervention. But Cancer Incidence was a pre-planned secondary analysis of this trial. The trial followed these patients for about 16 years, and in that time, there were almost 700 malignancies that were diagnosed in this 5,100-person cohort. You can see that the risk of overall malignancy was not reduced in the individuals who had been randomized to the weight loss intervention. But when specifically looking at obesity-related cancers, and you can see they use different definitions of what these were, but there was about a 20% lower rate of developing obesity-related cancers in individuals who had been randomized to the weight loss intervention versus the control group. And starting, although these are very underpowered analyses, to suggest, again, a reduction in specific obesity-related malignancies in these individuals. So although these studies are certainly not definitive, they provide for the first time information that weight loss, even later in life, the average patient in these studies were in their 50s and 60s and not in their 20s and 30s, was linked to a lower risk of developing malignancy over time. In the last few minutes of my talk, I really want to shift to thinking not about weight loss for cancer prevention, but weight loss for cancer control. I think as we heard earlier, designing prevention studies is complex, and the reality is there really aren't large-scale attempts going forward looking at weight loss for cancer prevention. But there are studies going on now looking at whether weight loss and other lifestyle interventions should be a part of the way that we treat cancer in patients who are diagnosed with malignancy. In addition to the evidence from observational studies that we reviewed at the beginning of this talk linking obesity to cancer risk, there is also growing literature suggesting that body weight is an important prognostic factor for individuals who are diagnosed with early-stage, potentially curable malignancies. This is especially true in breast cancer, where there have now been more than 100 trials which have looked at the relationship between body weight at the time of breast cancer diagnosis and the risk of breast cancer-related and overall mortality. This meta-analysis, published by the World Cancer Research Fund about 5 years ago, incorporated 82 studies, more than 200,000 women with early breast cancer, and demonstrated that women who were obese when they were diagnosed with breast cancer had a 35% higher risk of breast cancer-related mortality compared to leaner women diagnosed with the same stage, receiving the same treatment, the same cancers. This was also true in both younger and older women, which was quite interesting given that the relationship between obesity and cancer risk is primarily seen in older individuals. And this is not just true for breast cancer, and we don't have time to review all of these data, but there are similar data emerging in endometrial cancer, in colorectal cancer, in prostate cancer, and perhaps in ovarian cancer. So this work has led to large-scale trials looking at the impact of weight loss and other lifestyle interventions on the risk of cancer recurrence and mortality in individuals with early-stage malignancy. There are six large-scale trials currently underway. 3 of these trials focus specifically on women with early-stage breast cancer and look at weight loss interventions. The other 3 trials enroll individuals with colon cancer, ovarian cancer, and prostate cancer, and focus more on exercise. I want to just talk a little bit about my group's effort. This is one of the largest of these trials that's going forward at this point and potentially serves as a bit of a model for the way of testing these types of interventions in cancer populations. This study is called the Breast Cancer Weight Loss Trial. It is a randomized trial that will ultimately enroll 3,136 women with stage 2 and 3 breast cancer, so at higher risk of recurrence, who are overweight or obese when they're diagnosed with the disease. They're randomized to a 2-year weight loss program or to a usual care control group. This study is being conducted through the NCI National Clinical Trials and NCORE, which is our community oncology research base. And the reason that's important is that we're enrolling patients from more than 1,000 clinics across the United States and Canada. The individual sites enroll their patients, collect disease information, and then the entire intervention is delivered centrally through telephone and web-based programming. Our primary outcome is looking at the impact of this intervention on invasive disease-free survival, which incorporates both localized and distant breast cancer recurrence, as well as second cancers and death from any cause. The trial began about 3 years ago, and just as an indication of the interest in this area amongst the oncology community, we have now enrolled almost 2,400 women over these 3 years. They come from 49 states and 7 Canadian provinces. We have recently passed an analysis demonstrating that our weight loss intervention was successful in lowering body weight in our patients randomized to the intervention. And we anticipate that we will have an answer regarding whether weight loss interventions reduce the risk of cancer recurrence in breast cancer by 2024. So this is obviously a very high-level view of what is a very active area of investigation, but I really want to leave you with a sense of the strong connection between obesity and cancer risk and the hope through the bariatric surgery studies, through the look-ahead trial, that weight may be a modifiable factor that we can influence and potentially reduce the risk not only of developing malignancy, but also hopefully in the coming years of dying from malignancy. And I am hopeful that the next time I speak to a group like this, we'll be able to say that we include weight loss as part of our standard breast cancer treatment along with all of our targeted drugs. So thank you very much for your time.